Welcome to the deep dive. Today, we're getting into a really specific type of chest pain. It's called variant angina.
That's right, sometimes known as Prinzmetal's angina. Okay, so the absolute core of variant angina is something called myocardial ischemia.
Right, reduced blood flow to the heart muscle.
Yes, but the cause here is the key difference. It's caused by a sudden, temporary narrowing of the coronary arteries, a vasospasm.
A spasm,
Okay.
okay? And the source material mentioned this can happen even if there isn't significant plaque buildup, atherosclerosis.
That's a crucial point. It can occur with atherosclerosis, but it doesn't have to. The spasm itself is the primary problem causing the ischemia.
And the timing. You mentioned it's not usually linked to exertion. The information points to it happening mostly at rest.
Yes, typically between midnight and around 8 in the morning. That resting state is characteristic.
Wow, so waking up with chest pain, that must be quite alarming. Does this specific timing, this early morning pattern, give us any clues? Okay, so if someone experiences this pain at rest, often during those hours, what brings relief? Is it different from typical angina relief?
Often, yes. Nitrates, a type of medication, are usually very effective in relieving the pain quite
Well,
quickly.
So that quick response to nitrates is actually a diagnostic clue in itself.
It certainly helps point towards variant angina, yes.
And if doctors manage to get an ECG and electrocardiogram during one of these episodes, what would they see?
The classic finding, though not always present, is something called ST elevation on the ECG trace.
ST elevation,
Yeah.
signifying that temporary lack of blood flow from the spasm.
Exactly. It shows that part of the heart muscle isn't getting enough oxygen right then.
So how is it formally diagnosed? I read about provocative testing.
Provocative testing exists, yes. It involves giving certain drugs, like ergot alkaloids, in a very controlled setting to try and induce a spasm.
That sounds risky.
It can be, which is why it's actually rarely done these days. Diagnosis usually leans heavily on the clinical picture, the story, the symptoms, response to nitrates, ECG findings if available.
Right, makes sense. So once it is diagnosed, what's the treatment approach?
The mainstays are nitrates, both for immediate relief and prevention, and calcium channel blockers.
Calcium channel blockers, they help relax the arteries.
Precisely. They work to prevent the spasms from happening in the first place.
And lifestyle, anything really critical there?
Absolutely. One thing stands out starkly in the medical advice.
Yeah.
Stop smoking.